Hi, my name is Maria Perez and I'm an occupational therapy student at Texas Women's University. Today we will be conducting a shoulder examination. So this part will consist of observing the shoulder, palpating the shoulder, and also range of motion. So the first thing that you want to do is inspect. What the things that you want to look for while you're inspecting the shoulder are any scars. Scars can be a sign of any surgeries a patient might have had in the past. The second thing you want to look for is swelling. Although swelling is sometimes really hard to tell because of the deep shoulder, the GH joint, if there is swelling, it would mainly be at the anterior part of the GH joint right here. Other areas where swelling may occur is the sternoclavicular joint right here, and the other potential swelling area is the acromioclavicular joint right here. The third thing that you want to look for is any muscle atrophy. And muscle atrophy mainly happens at the deltoid muscle and also the three rotator cuff muscles right here, which is the supraspinatus right here, the infraspinatus, and the teres minor. If there is any muscle atrophy, the shoulder will have a more squared look versus right here, Christina has a more rounded look, which is a sign of a normal shoulder. The last thing that you want to inspect for is scapular winging, and scapular winging would look more, and the medial part of the scapula, it would be more sticking out, where Christina right now, she has a normal scapula. Okay, so the second part after observing the shoulder joint is palpation. And we want to start the palpation right here at the sternum. And basically you want to move medially of the sternum and laterally here where you will see the sternoclavicular joint. And as you keep palpating more laterally on the clavicle, you will notice that this part of the clavicle is a little bit more convex, and as you keep palpating laterally, you will feel that this area of the clavicle is more concave. And as you keep palpating, you will get to the acromioclavicular joint right here. And also keep in mind, as you're palpating, you want to check for any tenderness or any pain the patient may be feeling. Once you keep palpating, here is the acromion process of the scapula. And you also want to palpate the humerus here laterally, just to make sure there is no tenderness or any pain. So as you keep palpating here again at the acromion process of the scapula, you want to just keep going and you will feel here the spine of the scapula. And you also want to just keep palpating medially the medial border of the scapula, and again make sure there's no tenderness or any pain. Also, you want to make sure that you palpate the rotator cuff muscles. And right here, you can palpate the supraspinatus muscle and also the infraspinatus muscle. Make sure you palpate all the way to the humerus and the teres minor. Always keep in mind that you're checking for any tenderness. And the last thing you want to palpate for is the axilla. So you want to palpate the medial part of the axilla right here, and also the lateral part of the axilla right here. And when you're palpating the lateral part of the axilla, you're basically palpating the posterior part of the humerus. Again, you want to make sure there's no tenderness or pain. Range of motion testing. But before we begin, we first want to look at the movement at the glenohumeral joint and the scapula. As Christina abducts her arms, the first 120 degrees of movement is due to the GH joint. and the last 60 degrees of movement is due to the scapula gliding on the thoracic cage. This completes the 180 arc of motion. Two things to look for during formal range of motion testing is the smoothness of the movement and the extent of the movement. The first thing that we're going to look for and test for is abduction. We're going to look at Christina anteriorly, and she will abduct to 120 degrees. If there is any pain in 120 degrees, this is due to impingement or rotator cuff pathology. If there is any pain in the last 60 degrees of abduction, this is due to the acromioclavicular joint. The next thing we're going to test for is external rotation. This is to see if she can lift her hand right behind her head. This movement is extremely important for functional tasks such as grooming. The next test is called the scarf test. You can ask the client to bring her arm across the chest like so. This movement is important for functional tasks such as dressing, grooming, or bathing. Again, if there is any pain at that movement, it is due to a acromioclavicular joint. Now we're going to look at Christina in a lateral view. And we're going to see shoulder flexion. Christina will raise her arms up to 180 degrees. And the next thing is shoulder extension. Christina will bring her arms up behind her. The next test is posterior view of Christina, and it is the internal rotation and adduction. Here, Christina will reach towards the middle part of her back, towards her scapula. This is extremely important in functional tasks such as scratching. Next, we will ask the client to do a push-up on the wall. During this assessment, we will look for any winging of the scapula. After the winging of the scapula assessment, we want to look for external rotation in the anterior view. And here you will ask the patient to bring her arms to 90 degrees of elbow flexion. And you're going to ask them to bring their arms out to the side of their body. This is about 55 degrees of normal external rotation. Next, we want to look at internal rotation, and you can ask the patient to bring their arms in. This is typically around 45 degrees of normal internal rotation. And this is it for the range of motion. Okay, now we will conduct the passive range of motion of the GH joint. The two things you want to look for are crepitus and end feel. I want to start off by placing my hand on the acromion right here and passively abduct the arm like this. And I also want to externally rotate the arm and internally rotate the arm, again, feeling that end feel of the movement and crepitus at that joint. The GH joint is like a ball and socket joint, and the muscles that hold it together in that joint are the rotator cuff muscles. A specific test for impingement is the Neer's test. So we want to flex the shoulder all the way to 180 degrees and internally rotate the arm. If this is painful, it's a positive sign for impingement. So the Hawkins maneuver is when the shoulder is flexed to 90 and the elbow is also flexed to 90, and again you want to internally rotate that arm. This is the Hawkins maneuver. Again, if this is painful for the patient, this is a positive sign for the test, and it demonstrates shoulder impingement of the rotator cuff muscle. Now we're going to test for the supraspinatus, the resisted isometric abduction, and the empty can test. So for the resisted isometric abduction, the elbows are flexed to 90 degrees and 15 degrees of abduction. The patient will try to resist the pressure as I come up behind her and apply the resistance right here, like this. Remember to not have the patient move the arm. You want to try to have the arm as stable as possible because you want to make sure that it is the rotator cuff muscle and not the joint. The next test is the empty can test. For the empty can test, you want to have the patient do 90 degrees of shoulder flexion and internally rotate the arm, just like she's emptying a can. And you want to come up to the humerus and apply resistance to both arms like this. This is again testing for the rotator cuff muscles. Now we're going to move on to the infraspinatus and the teres minor test. For this test, we're going to do the resisted isometric external rotation, where the patient has her elbow flexed at 90 and externally rotate the arms. I'm going to come and add resistance again to her arm, like this. Both arms if you can. Okay? And this is testing the infraspinatus and the teres minor. For the subscapularis, you want to have the patient reach up behind their back. And she's gonna lift off the hand off her back. Again, you want to apply resistance. If they cannot do this movement, if they cannot lift their hand off of their back, or if there's pain once I apply resistance, this is positive for the subscapularis lift off test. Now the subscapularis, you can sit down. For the subscapularis, you want to flex to 90 degrees and internally rotate at the arms. Okay? And again, I will try to pull out her arms. And again, if this is painful or if she cannot resist my pressure, it is positive for the subscapularis problem. Hi, for this part of the video, we're going to test the bicep tendon. And we're going to start off by placing the hand on the acromion of the scapula right here. We're going to drop the thumb down and we're going to flex the arm and externally rotate it, and you will feel the tendon of the bicep right here. We're going to start off with the Jurgensen's test for the bicep tendon test. We're going to place the thumb on the tendon of the bicep right here. We're going to supinate the arm, and at the same time, we're going to try to pronate it. At the same time, palpating up here, the long head of the bicep, and pronating. If this is painful or if patient cannot resist the pressure, this is positive for Jurgensen's test. The next test is the Speed's test. For this test, we want both arms flexed in front, supinated, and we're going to add resistance on the humerus like this. If this is painful or if patient cannot resist this movement, then it is positive for Speed's test. The next test is the acromioclavicular joint test. This is a very common cause for osteoarthritis of the shoulder and or shoulder injuries. So the first test we're going to start off with is the scarf test. For this test, we want to bring the patient's arm across the body like this as we apply resistance to the humerus, like this. If this causes anterior pain, this is positive for the scarf test. Another way is to bring the arm up behind the head and apply resistance to the humerus like this. Again, if this is painful, it is positive for the scarf test. The next thing we're going to do is test for glenohumeral stability. Can you turn away that way? Okay. And for this test, we want to grab the humerus and slide the humerus anterior and posterior. Now we're going to start with the myotome testing of the upper extremity, which includes C5 to T1. For C5, you want the patient to have the shoulder flexion, abduction, at the same time, elbow flexion. For C6, you want the elbow flexion and wrist extension, like so. For C7, we want internal rotation and wrist flexion. For C8, you want elbow flexion and flexion at the MCP joints. For T1, we want the elbow flexed and finger abduction, like this. And for the dermatome testing of the upper extremity of the arm, for C5, we're going to look at the lateral aspect of the arm right here. That's C5. For C6, we're going to look at the tip of the thumb right here. For C7, we're going to look at the tip of the long finger right here. C8 will be the little finger, the tip of the little finger right here. And for T1, we're going to look at the medial part of the humerus right here. And that